microcatheters, do we have too many or too few? How do we going to choose these microcatheters? I have a very short time to discuss this. So we just need to know why do we need microcatheters. Complex CTO antegrade approach is one of the main reasons microcatheters really got used. And once retrograde came, then we needed better microcatheters to assess the tortuous vessels and also to find the way back into the main vessel. Multiple tortuous vessels we want to reach as distal as possible, which is sometimes difficult to go without a microcatheter. And of course, when we have difficult bifurcations, angulations are not good, then we need microcatheters to assess them so that we can take two wires through them. So what is a microcatheter? We all know it's a catheter with a lumen which is made of different varieties to let wire go through, and they're generally broadly divided into single lumen catheters, which is based on the size of the catheter, dual lumens or angulated. This is the spectrum of catheters we have. We start with polymer only, which is generally a catheter which is just used to transit. You generally don't do much with that. Then came the braided ones, which allows you a little bit of flexibility and a little bit of push. It's generally used in tortuous vessels. Then came braided and coil, where you can have a little torquing ability so that you can get into a lesion, but at the same time be flexible. Then came the external thread coil for additional rotational assistance so that we can rotate it better without kinking the catheter so the wire doesn't get trapped. There's done complex, and of course we have special catheters. So what are the properties? Generally we look at catheters. How do we select? Main important is you have to look whether the tip is long or short. So you have short taper and long taper. Like Caravel is generally short taper, whereas Corsair is long taper. So although they look similar, but they have different uses. So your Corsair Pro may not work in a retrograde so easily as much as a Caravel would work. So you have to choose your catheter based on what you see. It's not only based on that it's a short tip or it's a very small microcatheter. Then better penetration and pushability in CTOs, where you need more push than you need a Turnpike, or you would need a Corsair is very difficult at times. You need a Tornus, but unfortunately Tornus seems to be losing ground. We don't get it very easily. And sometimes you just want to get into a very tortuous collateral where nothing else works, just a Finecross works at times. So you have to select your catheter based on that. The tip diameter is important. The important thing to remember is that the diameters and the vessel should be snugly fitting with the wire. Otherwise, there will be a lot of laxity in the microcatheter and your wire will not do the job it's supposed to do. So your tip cannot be very bigger than the wire. So generally it's either 0.016 or 0.018. You'll never have a generally bigger than that. And for epicardial vessels, you need a catheter which has very thin with smaller tip diameter. That's the best. That's a Finecross is very good with a 1.8 French diameter. Wire diameter compatibility, which I always discussed with you. So you need very less gap so that you do not end up having a lot of gap between the catheter and the microcatheter. Angulator tip is used if you have difficult accesses, especially if you have bifurcations which your wire doesn't go very easily. So you have these venture type of catheters. We don't have the Ninja catheter. I'm sure they might bring it one day. But venture also is not easily available, which is from Teleflex. We do get it. So this you can get into vessels which have at say 130, 140 degree angle, and you find it difficult to directly wire it. Radio opacity is important, so you know where your catheter is and where your wire exits it. Trackability, we've discussed it, the same thing again. Applications, we've already told you what I said in the first one. I'm going to just touch upon a couple of them. Caravel, you have to understand that there's a special braiding. Why do we need this braiding? Because as you push these catheters, this catheter should not kink. Otherwise your wire will stop moving. So you need this braiding. So it's a very typical feature of Caravel, so that even if you put it in flexible vessels, it does not kink. So it allows the wire, this to go in. Caravel is generally reserved for retrograde because that's easy. With a SUO 3, it works excellently well. So Caravel is a good catheter if you want to take it to a retrograde approach. It can be used in the antegrade, but whenever you use for retrograde, remember you have to take the longer one, the 151, so that you have enough length to change it. That's the construction of it. We won't go into detail of that. Then there is Corsair Pro and there's Corsair Pro XS. Corsair Pro is not the best catheter for retrograde. It can be used for antegrade. Corsair actually started for using in cart, and reverse cart was possible with that, and it allows you to change the catheters. For a retrograde, it's a good catheter, but not as good as Caravel. It can serve septal collaterals. You can do selective contrast injections with this. And now the tube catheter, the Corsair Pro XS, is also used for epicardial collaterals. So XS can come closer to Caravel, but not exactly like the Caravel. And the other advantage is you can move it front and back with a counterclockwise or clockwise rotation. But the maximum rotation should be 10 at the most, and then you unwind it, otherwise you might end up damaging the catheter. There's the excess. Again, it has the same the braids around that so that it doesn't get kinked. Tornus was one of the best things. I don't know why it went out of vogue, because this was used for uncrossable CTOs where your wire could go across. Of course, Nimit is sitting here, he'll tell me use a laser. But Tornus was used for that. And Tornus probably is coming back, I don't know, you will have to find out, but it's a very good catheter to use. And in some amount of calcium, it works. So do not use it in extensive calcium, because you might end up unwinding the coils, and then it's very difficult to bring it back. Then you will have to probably end up with surgery or something like that. So be very careful when you use it, how much you can torque, how much you can counterclock. Then you have a turnpike. This is again similar catheters which is used for pushing clockwise rotation. Then there's turnpike spiral. There are different rotations you can use. It's used for mainly antegrade so that you can rotate it very well. Again, do not over rotate it. Turnpike Gold has an extra special gloat plated stainless steel tip. Finecross. This was actually the first one that we started using when we started doing CTOs or exchanging wires. It's a very beautiful, easily trackable catheter. But the important thing to remember, this doesn't work in antegrade. So if you're going to have a tough CTO in antegrade, Finecross doesn't work because you cannot torque it, you cannot push it. It just tracks down if it is easy. Similarly, it's mainly used for retrograde. It's low profile, non-torqueable microcatheter, but the crossing profile is 1.8 and is very beautifully hydrophilic coated, and it's a very good to exchange wires. So if you have managed to penetrate the distal cap and you want to exchange to a rota wire, this is one of the best catheters to take it down, and you can push the rota wire through it. Of course, Corsair also can be done for the same. And these are the other microcatheters we have. Teleport, I'm not going to do that. Mamba Flex is not available with us. Supercross is good kind of catheters are available. They have multiple angle option for angled vessels. Then similarly, we have Dual-lumen. We have the Sasuke, which is from Asahi, and we have the twin pass torque and twin pass. They are mainly used to access two vessels at a time, or you want to do an anchor balloon. Put an anchor balloon in one of the side vessel or subintimally, and you cross the main vessel with another one. So these are good catheters. The one we routinely have in India is the Crusade catheter, which is easily available. Again, it's a dual-lumen catheter. The recross. So how do you select? This is a very beautiful chart. How do you select? Looks very complicated, but it's not. First of all, you have to assess the lesion, look for total occlusion. If it is yes, then you do the selection as I told you, based on Caravel or Finecross or Corsair Pro. And if it's not total occlusion, then you'll select dual-lumen catheters or your Corsair Pro or Corsair XS. So summary slide would be, so every lesion is different. These catheters have made life easy for us. We can cross any type of vessels nowadays. We can manage more and more composite lesion. Select your microcatheter very wisely and your job is much easier. Thank you very much.